Welcome to our 9th chapter in this series, where we will be learning more about mixed methods in implementation research. In this chapter, we will be learning about the differences between quantitative and qualitative research methods, the difference between mixed methods and multi-methods approaches, the added value of using mixed methods over standalone quantitative or qualitative methods, and the different types of mixed methods designs, and how they can be used in implementation research. Implementation research is complex, requiring that researchers move away from the traditional quantitative versus qualitative methodological dichotomy. Mixed methods research, as its name suggests, harnesses the unique strengths of both quantitative, representing the breadth, and qualitative, representing the depth, methodologies. It marries the expansive scope of quantitative analysis with the rich insights provided by qualitative exploration. Through this, synergies are developed that help researchers have a comprehensive understanding of the implementation complexity. Mixed methods are particularly useful in implementation research to explore the facilitators and barriers during implementation, to measure implementation outcomes, and to test updated implementation strategies. When choosing the right study design, you need to start with the research question. The question we want to answer guides us in picking the right study designs and methods. In implementation research, we use both quantitative and qualitative methods. But sometimes using just one of these methods doesn't give us the whole picture. That's where mixed methods come in. Mixed methods combine quantitative or qualitative approaches to get a better understanding of the question we want to answer. It's like using a magnifying glass and a telescope at the same time. Mixed methods can be used for all three areas implementation research focuses on, these being identifying and understanding implementation barriers and facilitators, measuring implementation outcomes, and testing of implementation strategies. Let's take a moment to look at the characteristics of quantitative and qualitative methods. Quantitative research follows a systematic and robust approach for collecting information, using it to describe, explain, predict, or control a phenomenon, event, or disease. Quantitative research primarily answers three types of research questions, including descriptive questions such as how much and how regularly, comparative questions such as what is the difference between, and relationship-based questions describing the relation or association between groups or variables. Data collection in quantitative research uses close-ended and structured instruments, and data is numeric, requiring less training, as the researchers use tools to collect data. Statistics are then used to analyze the data, which is summarized using numbers. Sample sizes are large, selected through probability sampling, which makes samples representative of the population being studied and generalizable. Qualitative research aims at gaining in-depth understanding of a phenomenon, or exploring a new phenomenon, and answers the how and why questions. Qualitative studies are excellent for understanding people's beliefs, experiences, attitudes, behaviors, and interactions. Using open-ended guidelines, semi-structured questionnaires, and probing, the researcher is the instrument for data collection, which requires more training. Data are collected as words, stories, and/or pictures, and are analyzed through content analysis, establishing themes or patterns. It is also collected as smaller samples through purposive sampling strategies, thus the findings are context-specific. Now, let's discuss which are the most commonly used methods for conducting quantitative and qualitative research. Quantitative study designs are classified into two main types: observational and experimental designs. Observational designs can be descriptive or analytical, while experimental designs are classified as analytical studies, and include randomized controlled trials and quasi-experimental studies. Data used in these studies can be primary data collected specifically for the study, or secondary data, including administrative data, health management information system data, or other routinely collected data. There are a wide range of qualitative research approaches, including grounded theory, ethnography, phenomenology, case studies, and narrative approaches. The most frequently used methods in implementation research are in-depth and key informant interviews, focus group discussions, and observations. To recap, mixed methods designs use both qualitative and quantitative methods for data collection and analysis in the same study. Mixed methods are employed when a solely quantitative or qualitative approach is insufficient for a thorough understanding of a research problem or question. Mixed methods are used to examine any aspect of implementation, encompassing factors that influence implementation processes, and related challenges. In implementation research, it is not only important to know what is happening, but also why it is happening, if we wish to promote intervention scale-up and sustainability. In contrast to using a single approach, integrating quantitative and qualitative methodologies results in a superior understanding of research issues. It does this by leveraging the strengths of quantitative, generalizability, breadth, and qualitative, in-depth knowledge, methods, providing complementarity. Mixed methods also allow triangulation of results, focusing on one phenomenon using different methods, development, sequential application of different methods, or expansion, expanded scope and range. Using a mixed method approach allows researchers to assess a research question from multiple perspectives, evaluating different types of outcomes and dissecting different types of causal pathways. Let's take a quick look at the difference between mixed method and multi-method approaches. Although the terms are sometimes used interchangeably, there are some key differences between mixed method and multi-method approaches. Multi-method research involves using multiple methods to investigate research questions, while mixed method research involves integrating both quantitative and qualitative methods to provide a more comprehensive understanding of a single research question. The multi-method approach implies using different methods, quantitative and qualitative, but without mixing them, that is, without any pre-planning of how the methods will be integrated, or specifying the underlying objectives for integrating the methods. Mixed method, on the other hand, requires some pre-planning, or pre-specifying how the methods will be integrated, and the purpose that this integration will serve. A helpful comparison is likening a mixed method approach, which answers one research question, to fruit yogurt that requires mixing yogurt with fruit, following standard proportions of yogurt with certain fruits. Not all fruits are suitable, while multi-method is eating fruits followed by eating yogurt, or vice versa. To ensure a robust mixed method study, it's important to begin by formulating a research question that incorporates both quantitative and qualitative approaches. This will guide the selection of methods and inform the overall study design. These questions or hypotheses can be introduced at the onset, or when they surface in a subsequent stage of the research. For instance, if the study commences with a quantitative phase, the researcher may propose hypotheses. As the study progresses to the qualitative phase, the qualitative research questions can be developed to test these hypotheses. For example, in the quantitative phase we might find out that the adoption of a new strategy is low and come up with potential reasons, so in the qualitative phase we can explore acceptability and appropriateness to understand the reasons for the low adoption. Alternatively, quantitative and qualitative components can also be initiated at the same time. There are 4 main types of mixed methods designs. The concurrent triangulation design conducts the quantitative and qualitative data collection at the same time. Results are then analyzed separately and merged, with similar weight being given to each. This design increases the reliability and validity of the results by allowing a more comprehensive understanding using different perspectives. However, it can be difficult to draw conclusions when divergent results are found. One method is not intended to always confirm the other method. It is also important to find divergent results, as those findings would not have been found had only one method been used. The sequential explanatory design conducts quantitative data collection and analysis first, and then follows with qualitative methods to help understand the quantitative findings. It can be especially useful when unexpected results arise from a quantitative study. The straightforward nature of the design is its strength, and so it is relatively easy to implement. The main weakness of the design is the time required to implement the two phases. The sequential exploratory design conducts the qualitative methods first, and then either the results are used to inform the development of quantitative instruments, or quantitative methods help explain or explore the qualitative findings. It tends to be used when the primary purpose is to explore a phenomenon because little is known on the topic, for example, when testing elements of an emergent theory or determining the distribution of a phenomenon in a given population. Finally, the concurrent embedded design. In this type of design, quantitative and qualitative research are conducted at the same time, but one method is embedded within the other. It gives more weight to one of the two sets of findings, with a primary method, quantitative or qualitative, guiding the approach. For example, a quantitative survey includes some open-ended qualitative questions. Even though it is usually done concurrently, data collection for the secondary method can also be conducted before or after the primary one. The two approaches are used to address different aspects of the research question, for example, measuring quantitative outcomes and describing the process, not to compare and contrast them as in the triangulation design. It is important, therefore, when choosing a study design, to take into account the research question, the implementation research outcomes that we are interested in, the timing, whether that be concurrent or sequential, the weighting, either equal or different emphasis, the type of analysis, whether it is mixed or if one phase complements or informs the next, the resources available, and finally, the expertise of the team. Visual diagrams, such as flowcharts with the research process, can also help in the design phase. Let's take a moment to look at an example of a concurrent triangulation mixed method study from Bangladesh. This study investigated the fidelity of the Kangaroo Mother Care program implementation, where an observation checklist, quantitative, was used alongside key informant and in-depth interviews, qualitative. This study could have also been designed as a two-stage study, where the research question of the first phase of the study would be, was the fidelity maintained in the process of kangaroo mother care, according to the National Guideline of Bangladesh? In the next phase, to further explain the quantitative findings, we could have formulated a research question like, what are the facilitators and challenges experienced by different stakeholders for the implementation of kangaroo mother care, according to the National Guideline of Bangladesh? However, if we wanted a general mixed methods research question, the question could be, what is the fidelity, barriers, and facilitators for implementing KMC, according to national guidelines in health facilities in Bangladesh? In this study, the quantitative methods found that the level of adherence to the guidelines varied according to the different steps of the implementation, with several gaps in the fidelity. Through further investigation using qualitative methods, it was found that the fidelity and feasibility were low, both for the healthcare providers and the mothers, because of multiple challenges. These included the following: lack of knowledge about kangaroo mother care benefits, reluctance of mothers to stay in the hospital for kangaroo mother care, as they felt they had to attend to their other household responsibilities, coupled with lack of support from their families, and difficulty for mothers to come back for their post-discharge follow-up. In addition, there was a shortage of trained workforce, low motivation of some providers, insufficient supplies, e.g., diapers, caps, quality food for the mothers, and inadequate facilities, unavailability of adjustable beds and bathroom near the kangaroo mother care room. Triangulation of the quantitative and qualitative data allowed researchers to compare the findings obtained from the observations with the information collected through the interviews with health providers, managers, and caregivers. The findings suggest that improving mothers' counseling and providers' training, and providing adequate support to caregivers and family members to comply with kangaroo mother care and the post-discharge follow-up, would facilitate the fidelity and the adoption of the intervention. Overall, using mixed methods can enhance the quality, validity, and applicability of implementation research findings. A more comprehensive and nuanced understanding of implementation issues allows a better adaptation of the guidelines and development of implementation strategies, thus increasing the effectiveness of the tools or programs. Let's review what we have learnt in this chapter. Mixed methods are particularly useful in implementation research to explore the facilitators and barriers during implementation, measure the implementation outcomes, and test the implementation strategy. Mixed method uses both quantitative and qualitative methods to answer the same research question, leveraging the strengths of both approaches for synergy and complementarity. Quantitative methods are about number and breadth, qualitative methods are text and depth. Mixed methods provide a more comprehensive and insightful understanding of the research question than standalone quantitative or qualitative approaches, and are different from multi-method approaches. There are 4 types of mixed method study designs, based on the timing, concurrent or sequential, the weighting, equal or different emphasis, and the type of analysis, be that mixed or when one phase complements, or informs, the next phase. And that's a wrap for this chapter. Remember, you can download the related references for this chapter as a resource. Join us for Chapter 10, where we describe different approaches to measure and assess implementation outcomes.